Hi, my name is Alisha Patel, and this summer I was an intern at Apt Associates in their Division of Data Science Surveys and Enabling Technologies, and I worked in the realm of survey research in their health group. And I'll be getting my Master's of Public Health this December in Health Policy at the University of Alabama at Birmingham. So a little bit about Apt Associates. It's a healthcare research and consulting firm that collaborates with private and governmental entities to improve upon domestic health disparities. They formed its survey research group in 1976, and its domestic survey research and health has continued to expand with projects conducted with the Center of Medicaid and Medicare Services, state departments of health, private entities focused on meeting clinicians' needs. Its current projects include the oncology care model that evaluates a payment and delivery model that aims to provide better quality and highly coordinated oncology care at the same or lower cost to Medicare. The joint replacement surgery is another project that it's evaluating, and it looks at patient satisfaction experience with the Medicare payment and delivery model. And lastly, the heart follow-up study evaluates health changes in New York City residents, and findings from survey research could influence policy to protect health and evaluate the quality of a population-based service. So as an intern in the DSAT division, I assisted in the integration of new survey technology, and that was used to accept Confirm-It Horizons, which is a new survey technology that is much more efficient and effective than the older version that Apt Associates was using, which is called Quancept. So I assisted in proposal development centered around Confirm-It Horizons, as well as introducing literature into a guide how-to book on how to use Confirm-It Horizons. I also formed templates for project proposals that we were sending in this summer. These projects ranged in the type of impact they produced domestically in the health sector, and they were all centered around utilizing this new Confirm-It Horizons technology that I mentioned beforehand. I also conducted data quality control, and a lot of this was to ensure that our client deliverables were producing and reflecting the accurate data that we had found in our analyses. I also tested data collection instruments, and this was with our web-based and telephone-based interview surveys, so a lot of our mixed method or mixed mode surveys, testing those before they came live, whether in a pretest or in the population base. I also summarized literature and survey development meetings. I conducted a literature review for several different meetings, and in one of them I was able to talk about my findings within the meeting to help illustrate how we'd want to develop our survey for our client. And lastly, I was able to partake in project kickoff calls, which is the introduction of a project before it comes to fruition and the survey or the work becomes live. So 3 of the projects that I worked on this summer were related to CMS, the New York Department of Health. The first was the oncology care model. It's a mixed mode survey that will be administered both on the web and telephone, and it's designed for oncologists and advanced practice providers and clinical care coordinators, and it evaluates this payment-based model to provide effective and quality health care at the same cost or less of a cost to Medicaid and Medicare. This impacts about 180 different practices around the country, and it's evaluating cancer and the fact that it's one of the most common cancer is one of the most common diseases in the country. The next was joint replacement study through CMS, and the joint replacement is one of the most common inpatient surgeries in the United States, and this is also a mixed mode survey that was administered via paper and web, and it was regarding the care received before, during, and after joint replacement surgery. And lastly, I worked on the heart follow-up study, which is part of a larger initiative conducted in New York City that APT controls, and that's with CHS, the Community Health Survey. And the idea behind that is to measure sodium intake and to ultimately decrease sodium and intake and high blood pressure, which are two risk factors of cardiovascular disease, which is very common in the state of New York. So basically, this survey was incentivized respondents to collect urine for 24 hours, have their vitals taken, and complete a survey. I was mostly on the project management side of this study, and really working with the answering service that was related to the study, and whatever obstacles were coming about as the study was coming to fruition, and we were working with a pretest. So I have an overview of the key takeaways that I was able to exhibit this summer, and one of those is the evolution of random digit dialing. That has kind of evolved to more of a frame transition, and now needing more of an address-based sampling to reach survey respondents. So now we're also having a mixed method approach, so utilizing like telephone-based as well as web-based and paper-based surveys to increase the number of respondents that answer our surveys and reduce bias ultimately. I mentioned a little bit about survey development. That was one of my most exciting things I got to be a part of this summer, and that's a lot of brainstorming and coming together to see how and what ways can we provide the best survey for our clients to gain the information that is needed. I talked about the new survey technology that we are utilizing called Confirmant Horizons. I conducted telephone, in-person, and web-based quality control checks with Confirmant Horizons. And lastly, was able to assist with proposal development with work that we contributed this summer and are hoping to win. I met several M.P.H competencies. The first was M.P.H competency number 19. I've communicated the findings of my literature review in meetings with the National Association of Chain Drug Stores, and that is at the very beginning of survey development. In my literature review regarded how we measure tasks and how we can continue to validate those types of study in the work that we do with NACDS. I also presented my findings at the Intern Expo at Apt Associates. I met M.P.H competency number 7 by assisting in survey development and incorporating how to speak with clients and create a survey and frame that best suits their needs. So I mentioned this with NACDS in my last competency, but I also got to do this with the University of South Carolina and Boston University, as well as Apt Associates work with the Office of Victims of Crime, and they're creating a mass victimization resource center where they want to evaluate the type of mental health issues or that people confront following a large public health crisis. I was able to go through the survey with them and address any issues that I came across or how to better administer the survey. I met M.P.H competency number 4, and for the heart follow-up study, I collected and analyzed data from those who had responded to our survey in the pretest. I created a data set that was then transferred into SAS and is sent to our clients, the New York City Department of Health and Mental Hygiene. I also ran DISPO reports every week with our CMS project with joint replacement, and these disposition reports basically talked about the number of respondents that had completed the survey, in what mode, if we had any callbacks, if we had people who refused to complete the survey. And this is something that we track every week to understand who and why people are responding to our surveys, so we know how to better administer the survey. I met competency HCOP number 2, and in all 3 of these main studies I focused on this summer, they were evaluating some sort of the National Healthcare Service program and its needs. We evaluate a payment-based model with the oncology care model. We evaluated a payment care model, but also the type of care that is provided for people who are receiving joint replacement surgeries. And we evaluated the healthcare of New York City of people living in the city who may be exposed to high sodium intakes and high blood pressure, and trying to understand how it's impacting them long term. And lastly, I met HCOP competency number 1, and proposal development, especially when we're establishing budgets, it's imperative to be able to stay true to those budgets. And since we are going through a frame and mode transition in how we conduct our surveys, we worked with third-party contractors, and I created a budget where I compared different contractors to see how much money it would cost to change both frame and mode when we are submitting proposals, especially with our larger projects such as the New York City Department of Health and Mental Health Hygiene. So some of the lessons that I learned is that study logistics don't always go as planned. With our heart follow-up study, we ran into several issues that were unanticipated that came with how the study was going to be conducted and the answering service. I evaluated the answering service several times to ensure that they'd be able to answer our questions and the respondents' questions as well as possible. So that came up with redistributing the FAQs that we created and being as thorough as possible with them. And my other lesson is that proposal writing is no easy feat. And it takes a lot of time and practice to get more used to that type of writing, that type of convincing, efficient, and effective writing. And I can't say that I've mastered it in any way, but I think I started learning in the right direction and how to go, and I'd like to continue that type of business development mode as well. So this is a little summary of my work at Apt Associates this summer, and I hope to continue in the consulting realm and being able to interact, communicate, and collaborate with experts within their own fields and look at these public health issues from a broader view, and also apply my technical expertise in my viewpoint as well. So thank you very much, and I hope you all have a good day.